How much mercury really gets spread around when we drill out an old filling? A team of investigators affiliated with IAOMT set out to answer this question.
So the results of the study basically confirm that we are underestimating a source of mercury, and it can have massive implications on how dentistry is practiced. The amount of particulate that comes off of these dental fillings when they're drilled is monstrous. And unfortunately, in a regular practice, this particulate is not treated as anything that's of significance. So it changes how we think about doing things, and in this case, we'd want to mitigate any possible exposure to both the dental worker and also the patient. So it means completely respecting that exposure, removing it from the office as quickly as possible, knowing where this material can land, and maybe even the design of the dental operatory itself and how we handle this material. We also have to understand and respect the fact that mercury vapor is absorbed via the skin. So that means that skin has to be protected from this source. So any possible skin exposed to this particulate has to be covered by some form of barrier that is resistant to mercury vapor getting through it. The implication of what we found in this study goes to the practices making changes in how we protect especially our staff. This is an occupational matter. If you understand that when you do drill out mercury fillings that this particulate is being spread out all over the place, some of the important areas that we have to consider especially are in the dental workers' wrists, their hands, their forearms for sure, and understand that this exposure is an everyday occurrence that may happen 3 or 4 times a day. So we have a big problem, and we have to start recognizing that this particulate, this waste, is a big deal. And the first step, in my opinion, to trying to mitigate this exposure is to stop putting it in the first place. We have to start looking at the alternative materials. They're safe, they're effective, they have longevity, and if you consider the environmental impact and the cost of use through its life, amalgam fillings are the worst and most expensive material that we can think of using.